Have you ever wondered what it's like to really be a nurse in the US? Before I became a nurse in the US, I never knew that some of these things were going to shake me to the core. But let me save you the stress and share you my own experience. Hi guys, I'm Stephanie and I'm a US-based nurse, and on my channel I speak so much about nursing in the US, especially sharing my experience to new nurses and aspiring nurses, hoping that one day when you become a nurse, you're going to be a confident nurse like I am right now. Now, if that is something you're very much interested, please do not forget to hit the like button, the share and subscribe, and join my bubbly family to learn more about nursing. And if you're a nursing student and you're still in nursing school, I promise you that this video is going to be a game changer for you, because it's going to prepare your mind state about what nursing truly is about. In today's video, we're going to dive into 10 truths I never knew about nursing until I got into the game. And I'm going to be telling you guys in no particular order, and I hope that you can scribble them down, keep them in your mind, and work on those things that you feel like might be a game changer or a deal breaker for you before you get into the profession. The very first thing you need to know is that nursing is more of a mental challenge than a physical challenge, and I'm going to explain. Nursing is that profession wherein you're going to be taking care of like 4 patients, you're going to be answering to like several doctors, you're going to be responsible for family members asking you questions. It's not more so only about giving patients medications, attending to their medical efforts. Maybe patients are crashing, yes, they might be crashing, but it also has a lot of mental aspects to this career. You're going to be, maybe a patient is just confused as to what the care plan is for their issue that they're here in the hospital. There's going to be family members who are wondering like, okay, the patient is in pain, they're taking their pain medicine, why is the patient not even getting better? Or it's going to be a patient who was expecting to be getting better, but they're going the other side and they're going to be having all these questions. Or maybe you are on that very critical floor where your patient is crashing and they need support, they need emotional support, the patient, the family as well, and you have to hold hands, you have to talk with them, you have to bring your mental capacity, you have to bring your A game, you have to be strong enough to hold yourself mentally, control your emotions in this situation, and you have to be there for your patients. So you have to remember that in as much as you'll be giving medications to your patients, in as much as you'll be caring for the patients, maybe you're cleaning them, giving them their bath, they've pooped, you have to clean them, give them IV medications, attend to everything, take them for procedures, answer every questions, attending to maybe like little things that family wants to know about the care plan for the patients. It also is going to be draining you emotionally and mentally. The next thing I want you to know is that you see this career called nursing, oh my goodness, you are going to doubt yourself a lot. There's going to be so many times you're going to doubt yourself. Am I doing the right thing? Am I giving the patient the right thing? Is it the right time to do certain things? Am I asking the right questions? Should I reach out to the provider now? The way the patient looks now, is this okay? Is this something concerning? Is this something critical? Just know that in this nursing career, you're going to be doubting yourself so many times. Even seasoned nurses have in so many times doubted themselves. Even charge nurses have been like, okay, let me ask someone else. I can tell you that doubting yourself is part of the job. That is why you get to ask questions so that you can know the right thing, the right answer, the right situation, and how to act in that patient's situation at that moment. So be very, very conscious of the fact that you see this career called nursing, several times you're going to doubt yourself, and be sure to remember that it is normal. Very, very normal. The next thing I want you to know, which is the third thing, is that you see this exam called the NCLEX. So many nursing students feel like, you know what, after going through nursing school, the big and the major thing is sitting down for that NCLEX exam, writing the exam, passing it, and you are done. Let me tell you, that is not the final boss about this nursing career. The job itself is the final boss stop. Granted, there's going to be a lot of things that you're going to be studying to prepare yourself for the NCLEX. I know the NCLEX exam can be very daunting, can be very intimidating, can be very heavy, can be very draining. But let me tell you what, there is more ahead in your career as a nurse, and I will tell you for free that the job itself is going to be your final bus stop, because so many things that you've learned during nursing school, you get to apply them on the job. And I will also tell you for free that, hey, the job itself is also going to get challenging in terms terms of like, okay, did they teach this in nursing school? Okay, what did the teacher say in this kind of scenarios? It's going to be more practical than, you know, the didactic part, but I am not saying that the didactic part isn't important. I say all this to say that for nursing students who are studying at this time, who are preparing for the NCLEX, make sure to understand that in as much as you're preparing for the NCLEX, the bigger picture should be the job or your career in the long run, because the NCLEX is just there to prepare you, to prove to the board that you know what you are going to be doing in the field when you get to the hospital. And the more challenging aspect is going to be you taking care of those patients. So whilst you're preparing for your NCLEX, always make sure that you're looking forward to the job itself. My fourth point is that know that not every nurse is supportive. Let me tell you, there are going to be days when everybody is going to be very busy, and there's going to be days when some people will not be able to give you help and support that you genuinely need. One thing about our nursing career you have to understand is that when you're going to your job, or when you're going to your shift, when you're going to the hospital, you never know how it's going to look like. You might come to the hospital, they give you your patients. Yes, you look through the acuity of the patients that you will be having for that shift. It might look like everything is okay, but before you know it, maybe a patient you have to call like a react because maybe the patient needs more oxygen, or maybe the patient's mentation has changed, or maybe the patient's blood pressure is either going high or is going low, or the patient's heart rate is going high or going low. Imagine in that scenario where you are having a patient, or maybe two patients in that situation, where one patient is becoming septic, the other one maybe needs increase in respiration needs, and another nurse too is having maybe two patients who are constantly calling for pain medicine. Another nurse is also having a situation where family members for maybe two of their patients is constantly asking questions. Another nurse has a patient who maybe is on some procedure that they need to watch them closely. Another nurse is having patients on drips, maybe heparin drip, and they have to be titrating and, you know, following up with lab numbers and lab coming to do their lab draws. Let me explain something to you, especially to the new nurses. I do understand that during nursing school you were explained, or you were told that in nursing is you know, we work together to make the shifts an easy and peasy one. Let me tell you that there's going to be shifts where nurses are going to be available to help you. I don't want to scare you, but you know what, some days there are going to be shifts that nobody is going to be available to help you. Even the charge nurses are going to be super busy because they're helping other nurses. I am not saying that to say that nurses are not supportive because the acuity of the patient is going to be so. I am also saying to say that some nurses are not going to be supportive just because that is who they are. Some nurses, right, I've worked in some hospitals wherein when you get a new admission, some other nurses are going to come inside the room and help you with what do you need in terms of the admission. Do you need maybe the pulse oximetry? Do you need blood pressure cuff? Do you need the heart rate monitoring? Like, what do you need? Do you need a hospital gown, the ADL equipment, and, you know, cups, toothbrush, toothpaste are going to help you to make sure that your patient is comfortable and set up to begin the shift when the patient is on the floor. But I've also worked in some hospitals wherein your patient is coming, everybody is just, it's like nothing is even happening. You get to figure it out all by yourself. You get to run around, prepare, make sure there's a gown, there is toothbrush, toothpaste, blood pressure cuff, oxygen, and all of that. Make sure you understand, and you're coming to work with the mindset that, hey, I have to be proactive as against, you know, doing things when things happen. Then take, for example, you are receiving, or you are expecting to get a new patient. Make sure that everything that you need for that room is in the room. Make sure that the patient gown, toothbrush, toothpaste, cups, blood pressure cuff, oxygen, you know, measuring equipment, basically the vital signs, measuring things are already in the room. Everything, so that once the patient hits the room, you are set and ready to run off when the patient is in the room. Always remember that other nurses are going to be busy, and so they might not be necessarily there to help you. Also remember that some nurses, it is just in their nature that they will not be supportive. If you have your issue, especially when it comes to admission, that is one thing I've noticed. People tend to leave you to figure things all by yourself. But yes, I know if something critical is happening to your patients, people are going to come. But some nurses will just be like, you know what, they can figure it out. So just be on the side of knowing that some nurses will not be supportive. The fifth thing on my list that I want you guys to know is that shift work can be very mentally draining. 12 hours is no joke. 10 hours is no joke. And to some extent, 8 hours is no joke. I remember when I was still in nursing school and I was doing my clinicals or rotations, it was very, very stressful on my body because I had never done 12 hours. And then imagine you having to do that as a career, probably for the rest of your life. I want you to know that those shift works can be mentally draining. It's going to affect your body, your health, your friendships, maybe family ties. And I want you to make sure that you're coming onto this career with a mindset very prepared, knowing how to balance these areas of your life. It is your health. What do you do on your days off? If it's with your friends, how do you make sure that you're catching up with your friends? Stay in contact with your friends. Hey, what about family? Make sure that you're checking up on them, you're calling them, sending text messages, and you're just making sure that you are in touch basically with everything. Make sure that you're hydrating yourself, you're taking snacks, make sure that you're taking your breaks in between your 12-hour shifts, because I can tell you that 12 hours can be very long. Now, I know I work on a critical floor, and I'm one of those nurses who make sure that I take my break, and I take my break in such a way that you see that 30 minutes, I take my 30 minutes uninterrupted break because I deserve it. I need it for me to be able to regain back all the energy I've lost within maybe like the first 5 hours or 6 hours from the beginning of my shift. So always make sure that you're taking your breaks. Always make sure that if you need to hydrate yourself, you're hydrating, you're drinking your water. You need to keep up with snacking because you need the energy. Just make sure that you're having some sort of time for yourself to make sure that you are not breaking down, to make sure that you're recouping, you're regaining your energy, and just make sure that you're taking care of yourself even whilst you're at work. So always remember that. The next thing I want you to understand is that advocacy is non-negotiable. You have to always remember that your patient, you are the last line to save your patient's life. If you see something funky, if you see like, this patient looks different. Okay, at the beginning of my shift, the patient's blood pressure was this. The patient was very alive, very bubbly, very talking. But now I'm checking the patient's blood pressure. The blood pressure kind of looks soft. The patient is not answering questions appropriately. Know that you're going to be the last line to save that patient's life. Know that you are that person who has to advocate for your patient. I'm saying all this because these are things I've learned in my nursing career, which many people, especially new nurses, will not quickly pick up on or would not know from the beginning of their career. And I dare to even say some nursing students are very blank in terms of what to expect in the nursing career. So always remember that you are the person to advocate for your patient. If the patient needs pain medicine and they don't have pain medicine, you reach out to the provider or whoever is in charge to make sure you get that pain medicine. If the patient's blood pressure is low, is high, make sure you're reaching out to the provider for medications to help in that aspect. If the patient's mentation is changing, if the patient's urine suddenly changes, if the patient suddenly starts having like liquid bowel movement, you should be like, C. diff. If something just out of the ordinary just starts happening to your patient, make sure, remember that you are the person to advocate for that patient. If for any reason you're reaching out to a provider and the provider is not responding appropriately, you again are the one to advocate for your patient. You reach out to the charge nurse, you say, hey, I've reached out to the provider 1, 2, 3 times, it's been an hour, 30 minutes, it's been 2 hours, the provider hasn't responded yet. What is the next line of action? What can I do for my patient? Because I'm worried that something might happen to my patient. The patient looks different, the patient looks critical. Always remember that you have to be the one to advocate for your patient. The next thing I want you to always remember is that you see this thing called chatting. It's going to save you your license. It's going to save you, years of going back to nursing school. It's going to save you how many hours of restudying again for the NCLEX. I want to tell you, especially the new nurses, please come closer, come closer, come closer. You see this thing called chatting, make sure you don't joke with it. Whatever you do to your patient, make sure you're documenting it. If you did not do something that had to be done, make sure you're documenting it. Hey, the patient's blood pressure was this. I reached out to the provider. The provider has not yet responded. You go there, you chat it. Hey, patient's blood pressure was this. I reached out to the provider at this time. The provider is yet to respond. Hey, I reached out to the provider again for the second time. The provider hasn't responded. Hey, the patient's status mentation has changed. I reached out to the provider. The provider has not yet responded. Hey, the patient's blood pressure was low. I reached out to the provider. The provider wrote an order for 1 liter of the blood pressure of this patient. Make sure that you are chatting, because let me tell you something that happened to me. And thankfully, I didn't get into any issues. I had a patient who came from the ED, and when this patient came from the ED, I knew already that this patient had low blood pressure issues. But before the patient came to the ED, the patient had already taken med-surg like 5 minutes ago. So I knew that it's going to take some time for the blood pressure to come up. Now the patient comes up and the blood pressure was still kind of on the soft side. The patient has ascites, the patient has jaundice, you cannot give Tylenol. The patient also has edema, so resuscitating the patient's blood pressure with fluid is not necessarily an alternative at this point. The patient also had like a distended belly, so there were all signs that show that, hey, even though the patient's blood pressure was low, we could not give the patient fluid. We were kind of limited to oral medications, which was the med-surg that had been given, but again it was not being effective. So I reached out to the provider, and it had been a back and forth with the provider, letting the provider know like, hey, the blood pressure is not getting any better, the patient's mentation is kind of changing. The patient is now saying like they don't feel good, but vitally they are okay except for the blood pressure. Now I did not document this right up until maybe like towards the end of my shift, and tell you what, when I came later on that same night, they said the blood pressure tanked again before it went up. Fast forward to 2 weeks after that, my director on my hospital came and reached out to me and said, hey, we noticed that the patient's blood pressure was going down, but you did not do anything. You only documented at this time that, hey, the patient's blood pressure had been soft and this. And then I told the director that, hey, I reached out to the provider, and the provider was aware. The provider even gave the patient IV antibiotics. So the sepsis team alert nurse reached out to me and said, hey, this patient's blood pressure has been dropping, and I see that it's triggering like a sepsis alert. What is going on? What do we need to do for this patient? So I responded to them that yes, the provider is aware and the provider has put antibiotics. So she said, antibiotics for low blood pressure. I said, well, she responded that antibiotics was kind of like the only measures or the only thing that they could do at this time. Mind you, all this conversation I never documented that, hey, I've been talking to the sepsis team alert, I spoke to the provider, they gave antibiotics, they were aware, the only alternative for antibiotics. Hey, I never even knew that antibiotics can help a patient who cannot take fluid and who are already taking oral med-surg to help them with their low blood pressure. So I did not document this right up until the end of my shift. So when the director approached me and she was like, okay, we noticed you didn't do anything and you only documented towards the end of the shift that, hey, this is what had been happening all through your shift. So she said it looked like I didn't do anything for the patient. It was then that I had to bring out the conversation between the provider and the sepsis alert team nurse for her to know that, hey, I actually reached out. So I could have gotten into trouble if I did not show proof that I had reached out to the appropriate people for something to be done for this patient. Now I got covered, or I escaped from that route, but I'm telling you, especially the new nurses, please always make sure that you are documenting. I'm going to tell you another funny thing about chatting. Whilst the director was talking to me about this chatting incident, another nurse was close to me and she was hearing the conversation. So she turned to me and she told me that, hey, she had also gotten in trouble because she did not document something very silly. And I'll explain to you what happened. She told me she got a patient at 7 o'clock. She gave report. At about 1 o'clock, physical therapy came to work with this patient, and guess what? The patient was soaked. The patient was wet with number 1. So the physical therapist went there and wrote in their note, patient neglect. Guess what? The night shift nurse was the one who got dinged for it. So when they called her into the director called her into the office. They started asking her, this patient at 1 p.m. Mind you, we work night shift, we give report at 7 a.m. But tell me how this night shift nurse is going to be getting dinged for patient who was found at 1 p.m. during day shift, soaked and wet. The day shift nurse said, they were busy with another patient because they were kind of with another patient who was having seizure issues, like they were having back-to-back seizures. So apparently they didn't have time to constantly check. And I also feel like, hey, what was the tech doing? Yes, the nurse was busy, but what was the tech doing? It was 1 p.m. I don't see why a night nurse should have been called up even for a patient who was found soaked with urine at 1 p.m. That is like 6 hours after into another shift. Anyways, she said the director told her that next time when something happens, I always make sure that you are documenting. I gave reports, the patient was this, patient was that, and in my head I'm like, some certain things, right, you don't necessarily have to document them, but you know, when it comes to like the patient's vital signs and mentation and all those kind of much more critical things, yes, you should always make sure you're documenting them. But I said these stories to say that make sure you are documenting everything. I know that some nurses can tend to be on the over exaggerating side of documenting like everything, but make sure that you're covering yourself to document those things that you know that can get you into trouble. So always make sure you're documenting, always make sure you're documenting, always make sure you're documenting. I said that 3 times for a reason. The next thing I want you to understand is that, you know, this thing called boundaries, it is very, very essential, because if you don't have boundaries, this nursing job or career can lead to burnout very, very fast. Take for example, you have this patient who keeps calling for pain medicine. The patient is calling for pain medicine at 3:15. At 3:20, the patient is calling, I want water. At 3:30, the patient is calling, I want juice. At 3:45, the patient is calling that I want snacks. Hey, it gets to a point where you have to set boundaries for this patient. You come into the patient's room, you tell them that, hey, what is it that you want me to get for you before I step out of this room? You ask all those things so that you're bringing all of them at once, so that it makes you not to keep coming into the room back and forth. I can tell you that, you see, this job called nursing, you can burn out so easily, because there are times when the tech is going to be very busy, you know, taking care of another patient. You get to be the one to jump in and clean the patient. You get to be the one to give snack to the other patient. You get to be the one to go get toothbrush and toothpaste for another patient. In between that, you'll be the one giving medications. You're going to be the one making sure you're checking that the vital signs are stable. Or maybe the tech is also busy doing something for another patient, which you know, yes, is true. You'll be the one to take the vital signs. You probably will be the one to take the blood sugars, and you're also thinking, okay, is the blood sugar warranting insulin? Is the blood pressure medication appropriate for this blood pressure at this time? You have to set boundaries for yourself. Let me explain this even further. Make sure that if you're having so much to do for a patient, when it is time for your downtime, you tell yourself that, hey, this is time for my downtime. If anybody is calling you for help, you let them know that, hey, I've also been very busy, and let me just rest a little bit. When I recoup, when I regain some energy, I can come and help you. If you still need my energy, you have to set boundaries for yourself. If you don't set boundaries for yourself, let me tell you something, your body is going to set that boundary for yourself. And you know what I mean, you're going to be going to the hospital. So make sure you're setting boundaries for yourself. I know that there are so many nurses who love picking extra shifts. I know that we need the money, but hey, make sure you understand what your body can tolerate. You have to set boundaries. Because another nurse is picking up shifts and they're working 6 days a week does not necessarily mean that you can tolerate it, or you can handle even 4 shifts a week. Make sure you understand what your body can tolerate. Make sure you understand what your body can handle. Make sure you're setting boundaries for yourself. The physical therapy comes by, you have not chatted anything, and they're asking you to help you walk this patient while they do some other thing with another patient. Look, that is the time you will tell the physical therapist that, hey, I am running behind time. I don't have time to do this for this patient because I need to chat and I need to do other things for my other patients. Make sure you let them know that you have other things too that are priority for yourself. Don't let people kind of use you. Don't let people kind of like drag you all over, like, hey, I need help here, hey, I need help here. You also have that right to say, hey, I am also busy, or I need to catch up on certain things. So always remember to set boundaries for yourself, because this nursing job can easily lead to burnout, and you don't want your body helping you to set those boundaries for you. The next thing I want you to remember is that you see this thing called our paychecks. I know that gone are the days during COVID when nurses were working like 10,000, 7,000, 6,000 a week. Those days are far gone. Right now, those are just realities that will never come to pass. But you know what? Sometimes our paychecks will never reflect the amount of work that we put in. But you know, the good thing is that the work we do, the things we do for our patients will speak for itself. I want you to understand that the nursing career should not be that career that you're going into it for money. I understand that sometimes, yes, we want to be real, we want to speak the truth to ourselves. The money is also very important because, hey, we need to pay our bills. But if you're one of those people who is going into the career because of the money, I can easily tell you that you're one, going to hate this job, two, you're going to easily get fed up, you're going to give up on this job, three, you're going to easily burn out, because you're going to find yourself coming into work and you're going to be grumpy, you're going to be grumbling, everything is just going to be so annoying, and you're just always looking at the time to be like, how many more hours to go, how many more hours to go. I want you to understand that sometimes, which of course I can even tell you that so many times, you're going to look at your paycheck and you're like, really? After everything I did this week? And you're just going to be questioning yourself like, am I even in the right career? So always remember that even though nursing seems to be glamorized, if that is an English word, people say so many nice things about nursing. I'm telling you that there are going to be certain weeks or certain days that, look, the things you're going to do for your patient, be it is going to be a good Samaritan thing you're doing for your patients, you're going to be saving lives, but when you look at that picture, you're going to be like, is this even worth it? All the days that I went to school, everything that I went through in nursing school, looking at the picture, you're going to be like, I know you can pay my bills, but what is going to be left for me to take care of myself? Because guess what? Baby girl needs to be spoiled. Baby girl also needs to take care of themselves. So remember that sometimes the paycheck is going to look like it's not even worth it. It's not even worth the struggle. It's not worth the pain. It's not worth everything you've gone through for your patient. If you've reached this point so far, it's left just one more point. I want you to drop in the comment section what 9 things mentioned so far that has shocked you most. Is it the aspect that the paycheck is not going to be worth it? Is it the aspect that is going to be mentally draining? I want to know your comments. I want to know your thoughts. What is it about nursing that has shocked you as a nursing student, an aspiring nurse? Yes, an aspiring nurse, or already a nurse who is working on the floor? Let me know in the comment section. But the last thing on the list I want you to understand is that you see this thing called nursing. Yes, I know it can be a career. Yes, I know it can be a source of paying all our bills. It can be a source of, taking care of ourselves as well. But I want you to always remember that the nursing career is also an identity, or dare I say, it is very much so an identity. You see this thing called nursing. I feel sometimes like when I come home, I feel very good knowing that, hey, I saved a life. I feel very good that I'm one of that persons who can be looked up in the society to be like, these are the people who help save lives. These are the people who risk their own life to save other people's life. These are the people who are doing this for other people. These are the people who are taking care of other people's loved ones back in their houses, for those who are doing home health or in the hospitals. You have to always remember that in as much as it is a job, also remember that it is an identity. Thank you so much for staying right up to the end of this video. I hope that you found this very informative. Like, share and subscribe in the comment section. And from me to you, I'll see you all in my next one. Stay safe, stay blessed, and I'll see you all in my next one. Bye guys.